Yeah, thank you for joining us here this afternoon. As you all know, developing the ability to test for the COVID-19 virus here in the state of Hawaii has been a high priority, and I really wanted to start by thanking all of the workers here at the lab in Pearl City. I know many of them were involved, worked overtime to really accept the test kits and verify and go through the validation process so that we could be certain that the results would be reliable and accurate. And so I just really wanted to thank all the employees who are here who were part of that. The state of Hawaii is one of the first states to be able to test for COVID-19, and it has been a priority of ours. Since being able to test for COVID-19, there have been 2 people that were people under investigation for the virus. They both ended up being negative, so the virus was not found. There are 3 additional cases today of those that are in the process of testing, and some of them are from the neighbor islands, and Bruce and Dr. Desmond will be giving you more information. Yesterday, I joined 50 governors from around the country on a conference call with Vice President Pence and the task force on the COVID-19 virus. Certainly, it has been helpful for us to engage with other states and learn what each other is doing and how we are dealing with similar challenges all across the country. The discussion talked about seeking funds to fund the COVID-19 response. And so the administration is working with the Congress to be able to provide funds for the states to be able to respond to the COVID-19 outbreak. We continue to work very closely with the Centers for Disease Control and Prevention and the State Department of Health on the local website. Continue to post updates to this situation. It's very fluid, changing all the time. And so I certainly would encourage the media to visit the Department of Health website and visit often. I know that we are also issuing updates every day. And with that, I'll turn it over to Dr. Anderson.
I'm very pleased that Hawaii now has the ability to do the test for COVID-19. We're one of 40 states that have been authorized to go ahead and do the testing, and we've jumped right into it. Staff worked here 24/7 to get the test up and running, and they've done a terrific job. And we've already done some testing here and found, fortunately, no positive cases. There are still no cases in Hawaii that are confirmed. But we do have 3 individuals who are currently under investigation, one from Oahu, one from the Big Island, and one from Maui. Hopefully they'll also be negative, but we can now turn over the results very quickly. We actually were able to, in a few hours, get the results back last week when we had our first testing experience. So that's a huge advantage for us. Normally it would take about a week or so for us to send a sample to Centers for Disease Control and then get the results back. So this allows us to act quickly and appropriately when we do have a positive case and a negative case. Of course, we don't want to leave anyone hanging on the results any longer than we need to. I wanted to talk a little bit about the testing criteria for the state. We have expanded the criteria for testing from what it was previously. In the past, we were limited to testing people who were exposed in China or people who were exposed to an existing case. That's now been expanded dramatically, and we do expect a lot more testing to occur as a result. The disease is now known to be widespread in other countries. Iran, Iraq, Japan, South Korea, and Italy are all areas where the disease is circulating and places where we should be concerned if people were going and coming back and becoming ill. So we can now test individuals who have been exposed in those areas, and as well as China, of course. We also have the ability now to test people who have illnesses of undetermined origin, respiratory illnesses that may be infected locally. serious illnesses where other conditions have been ruled out. In all cases, people will have to go to, or individuals will have to go to a physician, of course, and the physician actually orders the test to be done. You can't just go and ask that your test be done. But if a physician feels it may be COVID-19 and has ruled out other possible causes, then of course we will do the test. We don't know how many tests we will be doing. The time will tell on that, but we certainly are able to do a lot more testing now than we have ever been in the past. A couple of other points I'll make. Our state lab is fully able to do the testing. This is a test that we've been doing for the flu for a long time, similar methods anyway used. So our laboratorians are familiar with the process. If we do have any positives, we're going to have to send those back to CDC for confirmation. But at least now we have a presumptive diagnosis or test that we can use to take action more quickly than we could before. And we will assume the test is positive if we find it positive, and we'll act accordingly. Negative tests, of course, will be handled appropriately. We do have daily updates in on our media update on the number of people under investigation. We'll continue that. So hopefully you all will be aware of what level of activity there would be. You very well will see an increase in the number of PUIs as we've expanded the testing criteria, so don't be alarmed. It doesn't mean we're seeing a lot more disease here. It means we're doing more tests and there are more people under investigation because of this expanded criteria. I might add one more thing that is of interest. The FDA must approve any test that's done, including the test that CDC has developed and provided to us. But they've recently allowed for private labs to do testing. And we are going to be working with the private labs to see that they develop the test in a way that's reducing errors, that they're specific and sensitive. So we will be looking at that possibility in the future. And again, that'll dramatically expand the testing. Last thing I'll mention, the health department doesn't charge for the tests that are being done here. Of course, there are other charges. Typically, there's physician charges and other charges, but this test is being done free of charge, so that shouldn't be a barrier for any physicians or others who are needing to have this test done. And with that, I'm going to ask Dr. Edward Desmond, who's chief of our laboratory branch, to talk a little more about the procedures for handling samples and how he actually processes those here, and anything else he might want to mention. Ed comes to us from California. He was head of the laboratory program there, and we're very lucky to have him here in Hawaii. I think one of the reasons why we were given approval to go ahead was confidence that he's here and can make sure that the job was done right. Ed?
Well, thank you, Governor Ige and Dr. Anderson. Welcome to the laboratory in Pearl City. We've been here almost 25 years now. It's a lovely site. I'll give you a little bit of background about our laboratory. We have 3 branches, including the Laboratory Preparedness and Response Branch. You can guess that that branch is tasked with the major task of working on newly emerging infectious agents like the novel coronavirus. And so it's their staff who are going to be giving you a demonstration and a tour. We also have the Medical Microbiology Branch, which works on more routine agents of infectious agents of public health significance. For example, influenza and other respiratory viruses, antibiotic resistance, salmonella and shigella, and infectious agents that cause infectious diarrhea. So the Medical Microbiology Branch is going to provide backup to the Laboratory Preparedness and Response Branch for the coronavirus testing. And also they'll be able to do testing for other respiratory pathogens to help to establish the diagnosis. And third but not least is our Environmental Health Laboratory, which tests air and food and water to make sure that we've got uncontaminated air and food and water. So Dr. Anderson mentioned that we have already validated the coronavirus testing. CDC has developed a test very rapidly, in my opinion. I've been in this field long enough to be quite impressed that when a disease emerges in December, and we have a rapid and accurate laboratory test before the end of February, that this is a very quick development of a molecular test, which is very well suited to the laboratory response network and uses the test platforms, and our staff are trained in using these platforms so we can do quick and accurate testing. So I'm quite pleased with that. Now that we have verified that the test works well in our hands, with the cooperation of the Laboratory Preparedness and Response Branch, LPRB, and the Medical Microbiology Branch, we have a capacity of testing up to 250 samples per week. We can handle that. And these will, the samples that we test will respond to the needs of our Disease Outbreak Control Division. So we work with them, and they help us to decide which patients are suitable for testing. This is a very rapidly evolving situation, and so I just learned today that CDC is making test kits available to the private sector. So we have an evolving responsibility. As Dr. Anderson mentioned, we want to make sure that the private sector, when they begin to do testing, that they do it accurately. So one of the requirements of the FDA for this emergency use authorization is that the private sector laboratories send their first positives to a laboratory which already has a verified procedure. So we'll ask that they send from other laboratories in Hawaii who are beginning to do this procedure, send their first positives to us, and we'll help them with their quality control. One of the things I've just realized is a task for us in the very near future is to develop a guidance for private sector laboratories who want to take on this kind of testing. So we're now prepared to have a demonstration in our training laboratory conducted by the Laboratory Preparedness and Response Branch. Yeah, are there any questions?
While you're there, can you just take us through the process of the testing itself? We're going to see it and get video of it and see it or pictures.
Okay.
If you could take us through what it is.
Okay. Well, the first part of the process that you're not going to see is the collection of a nasopharyngeal swab, not a very pleasant process, but an oropharyngeal swab. So both are recommended. And so those samples are collected and put in a viral transport medium and brought to the laboratory. And then we have a testing procedure which takes about 3 to 4 hours. So the first step is to extract the viral nucleic acid. And then what we're looking for is the viral nucleic acid, and we can detect even small trace amounts of the viral RNA by doing an amplification procedure called PCR. You may have heard of this, polymerase chain reaction. And then the presence of the amplified DNA is detected by fluorescent probes using a specialized instrument that we have, a real-time PCR instrument. And we run positive and negative controls to make sure that the batch of tests has worked properly. And part of the process is also the accessioning and reporting. And I think that's just sort of a quick synopsis. Is that kind of the level that you were hoping for?
Maybe even a little bit simpler, not as technical, so that
Okay.
our viewers might understand.
Sure.
what it is.
Okay, so we can detect a very small amount of the virus by amplifying its nucleic acid, its genetic material, and detect it using quite a sophisticated instrument, which we've had for quite a while in our Laboratory Preparedness and Response Branch.
Are we going to be focusing in on the more senior community since it's affected? That's what coronavirus seems to be affecting seniors more so than others. And so will the test be administered in care homes, or is that going to be expanded to that group of people as well, or do we know?
Well, that's a good question. As I mentioned, we work closely with the Disease Outbreak Control Division, the Disease Investigations Branch, and so they help us to set priorities in what samples we're going to test. And so I think I want to defer.
Governor,
Oh, I'm sorry.
Let me just,
add a little to that.
I mean, I think that right now we're working with the CDC in defining who is appropriate to be tested. That's really driven by the primary care physician. You know, they are meeting the patients, they are evaluating what the other kinds of diseases might cause the symptoms that they see, and they will be recommending the tests that for COVID-19 be administered. So we're not looking right now at this point in time about specific populations per se. It's really driven by a physician, and there is a criteria about what steps should be taken to rule out other sicknesses that might result in the same symptoms, to focus on those that are unknown and therefore candidates for COVID-19 testing.
How many tests have we done so far?
So we've done 2, and they have 3 more samples. Yeah.
That's here. How many have been done and then sent to CDC? Is that the same number?
No, same. Yeah, we've not sent anything to CDC.
Remember, we only send the positives
Right.
to CDC. If we find them negative, we're pretty confident they're negative, and we don't do that.
But I thought we couldn't do the testing here. We had to send all of them to CDC.
That was
Yeah,
the cases.
that was the case. We now have the capacity here, but we had no one under investigation. You know, remember, 0 confirmed cases of COVID-19 here. We've had 2 individuals under investigation that both turned out to be negative, and then we have 3 additional samples that we've just received.
So can I ask, why isn't Hawaii screening all travelers from affected areas with coronavirus now that the virus is significantly spread to other countries?
Well, so there is a process that we are looking at. I mean, clearly, traveling individuals who are sick are actually being turned away and not even being allowed to get on the flight and enter. So that's being negotiated and discussed at the federal level. You know, State Department is working with Customs and Border Patrol. They are working with the nations that have had confirmed cases and working through that, keeping people who are sick in their home communities rather than allowing them to travel. So we do some level of screening in the airports to identify those who are now at least beginning to be symptomatic, and then they're making assessments about whether they should or shouldn't be tested. Now, we've not had any requirement for testing a traveler who was identified through the process and determined that testing should occur.
We're still doing the travel history to China, you know, the fever scan, like only if you have a travel history to China, but we're not doing Japan or any other.
No, so it has been expanded to include travel to Japan, Iran, Italy, South Korea as potential areas where they might have been infected. And now the new procedure actually allows a physician to say if they've ruled out other illnesses that have these symptoms and they are at a loss at what might be a cause, then they can request that COVID-19 test be run at that point. And that's some of the samples that we are receiving now.
Are the testings being done with manual extraction? I do see a request for an automated extraction system. Do you anticipate just higher quantities of testing coming up?
Sure.
You do?
I would say this, you know, on the national conference call, I think, you know, we are preparing for the worst and hoping for the best. As you have seen in China, they've tested 80,000 individuals for the COVID-19 virus. So we clearly are looking at being able to accommodate as many tests as are required in our community. Dr. Desmond has talked about the normal capacity of this facility is about 200 to 250 samples a week. You know, as discussed, the federal government is looking at enabling private labs to also be able to do those tests. So we are working with other lab facilities here in the islands to determine which ones have the capability to be able to do the test, and then trying to determine who would be interested. You know, so the volume of testing is really determined by the number of suspected individuals who are here in our community. At this point, you know, there is no virus. There's no confirmed case of COVID-19. And, you know, we are seeing a slight increase in the number of people who are sick, and there's no other explanation.
And just to clarify the numbers, so you said roughly about 200 a week. Would that be 200 people, or will multiple testings on an individual happen?
No.
We would be able to handle about 200 to 250 patients per week. as you're apparently aware, sometimes we do need to do some repeats. But yeah, that's the number of patients we could test in a week.
Is this the only lab testing at this time?
In Hawaii. Yeah.
Well, there's also Tripler. I want to give a
yes.
nod to Lieutenant Colonel Alex Cayetani at Tripler, who has been most congenial. And so we have an informal arrangement with Tripler, which would need to be formalized before we helped each other out. But if they get a heavy burden of testing, or we do, and we need additional help, additional capacity, they would help us, and vice versa. They have received the same type of kit that we've received from CDC.
So right now, this lab does the testing, but at some point, private labs would, and then they would send over the positives for confirmation. Any idea on how long that will take before?
I mean, I think we are working with the private labs to see if there's interest for one, and then we definitely want to get them certified. You know, right now we believe we can deal with the volume of testing that is needed here in the state of Hawaii. But as part of our preparedness discussions, we want to be able to expand testing to whatever level the community requires. And so we want to, if the labs have the equipment and the capability to conduct the testing, then we want to certify them ahead of the need, so that if in fact, let's say we needed to test 5,000 samples next week, we would in the state have the capacity to do that testing if we need it.
Governor, can you talk a little bit about the Yahi Hospital, perhaps Wahiawa General, that folks are considering taking patients?
I mean, I think we'll be able to talk about it a little bit when we're further along in the process. You know, we are having conversations. We knew that we wanted to identify an isolated facility that would be able to take someone who does not need hospitalization, right? Because our hospitals are able to isolate patients and take them in all of our hospital facilities. So we're looking for somebody that doesn't necessarily need hospitalization, but is positive or confirmed case of COVID-19, and wanting to have them isolated from, the general public.
One last question, sorry, we
Sure.
gotta wrap it up and move on to the demo.
You may mention we're looking at places.
Yeah, go ahead.
Let me speak to that a little bit. Again, we're assuming the worst, and we're looking for locations on all the islands actually, so that we can avoid transport if that were required. So we're looking for places where people could get the wraparound services they need, meals and housekeeping and other things. People typically who don't have homes here. The people who have homes here, as is the case all over the country, they're generally isolated or quarantined in their home, where they're comfortable and compliance is usually very, very good. But for visitors here, which is a special situation for Hawaii, we're looking for places where if someone's sick and they're confirmed to have COVID-19, we want alternatives besides putting them in a hotel room, places where they could be, where they'll be away from the public and not exposing people. And of course, where staff can provide support without becoming infected. So that's the challenge we're working with now. We don't have anyone who meets that category right now. At the Navy base Pearl Harbor offered a quarantine facility, but it's only available for those who aren't symptomatic. So we're looking at all the different contingencies, and that's a group that we're needing to accommodate potentially, and we feel it's necessary to find those locations right away.
What do you have to say to folks? We talked about exposure, people that may be exposed who are coming from overseas. Because we're in Hawaii, there is such an influx of people from all around the world, and many people interact with them. What do you say to people who, now that we can do additional testing, they may be sick with the flu or other respiratory illnesses, and they may want to be tested for COVID-19 because they're concerned?
Well, we are still using the primary care physician as being able to capture the information that would help us. So we do want to have a history. We want to know if they've traveled. We want to know if they've have the possibility of being exposed. But we are also taking those cases where they've ruled out any other of the diseases, the flu and other things and it's an unexplained sickness with the symptoms, and we are testing those as well. So, you know, if someone is not feeling well, then the recommendation is to call your physician or your primary care doctor and give them the history and then schedule an appointment.
Theoretically, if somebody were to test positive or going down the road in the future, would anybody infected be able to recover at home? What triggers mandatory quarantine and isolation?
The policy at this point would be to, if it's a resident, that they would be quarantined at home. And the State Department has a very active monitoring program. They would be contacted several times a day to make sure that they are isolated and being in their home. And so we have we've found a great deal of success in doing that. Most people understand if they're ill that they don't want to get other people ill. Certainly, that's generally who most people would be taken care of in their home. I mean, that's the ideal. The other facilities that we're looking for are for travelers or visitors who really don't have a home here, and we need to provide some place for them to be in quarantine. And like I said, if they need hospital services, then our hospitals are capable of isolating them and taking care of them in the hospitals. If they are less than needing hospital services, then that's that window where we need to do something different. There's no place for them in the current inventory.